Hi, this is Dr. Mejia from Tampa, Florida. Just want to talk about our new corona antibody tests that we are doing in our clinic. So, if you're considering to have antibody tests, do a lot of research, ask a lot of questions. And as far as our antibody tests that we are doing in our clinic, it's made in the USA, not made in China. It's certified by CLIA. It is also accredited by the College of American Pathologists. It's listed with the FDA. We are doing venous blood instead of the rapid finger test. And the reason is because there's so many reports that the rapid finger antibody test is showing a lot of false positive results. Our test is available 24 to 48 hours later, not 1 to 2 weeks. Our test is sensitive 95%, and the specificity of our test is 97%. It's very important that the test should be accurate. There is a report 2 days ago from India in which the antibody test that was coming from China was only 5% accurate, and that is not acceptable. But what's amazing with our antibody test is that it also checks the titer. It does not just check the antibody, it also quantifies the amount of antibodies. And for me as a physician, that's very important. The LabCorp and the Quest laboratory diagnostic test for the antibodies, they're not even doing the titer. They're only checking positive or negative or a qualitative test. I just want to show you my own blood work from 2 days ago. To be positive or reactive, it should be above 1.0 AU per ml. And as you could see, my titer is below that. So my test is negative, and being a physician, I have to be careful. So who should get tested? Again, if you're sick, this is not a test for you. You need a swab or the saliva test. But if you were diagnosed with COVID-19 a few months ago and you have recovered, then this is a test for you to check whether you have produced antibodies. Now, if you were never diagnosed with COVID-19 but you were exposed to the virus, including healthcare workers like me, first responders, and high-risk patients like me again because I'm asthmatic, then it's very important to have the test. Now, if you were sick recently but weren't sure if you had a COVID-19 virus test, and if you want to confirm if you had the virus, then this is a test for you. I have several patients. They had a flu-like syndrome and their strep test was negative and their flu tests were also negative. So currently they're having the test now. Now, this is interesting. If you travel a lot or you work internationally, some of the countries are looking for some immunity passports or risk-free certificates. So you might have to consider an antibody testing. Let's just review about the positive COVID-19 antibody test. If you're positive, it means you had the infection. It means you have recovered from the infection. It means you were exposed to the virus. And it means you have some form of protection. So let's not twist science in here. If you have the antibodies, it means you have some form of protection. The only thing that we don't know is that whether the protection that you're having is a short term like flu. That's why you need a flu shot every year. Or whether the protection that you're having is long term, like smallpox, in which you're going to be immune the rest of your life. Right now, we don't really know the answer. This is a new virus, so everything is new. What are the benefits of having the test? Well, it's a paramount for our country to reopen safely. It's a key for letting people out of their homes again, and it would help quarantine healthcare that were previously sick to return to the front lines. It would also offer confidence, sense of security, peace of mind, and it would alleviate the fears of the unknown. And if you're positive, you could also help the community by donating your blood. Now, also, if you're positive and you travel a lot abroad, then you have some proof of some protection. So how do we do it? You go to our office, we ask you some questionnaires, some questions, we drew your blood, we process your blood, we enter the data, and the specimens are being shipped overnight. The laboratory would be doing the testing, the laboratory would be doing the reporting. And once I have the report, we would provide you with a copy, and we will be doing some telemedicine consultation. So, interested? Then you could give us a call or you could text us 813-960-3436. Thank you for watching. Bye bye.